Hello everyone, I am Jennifer Harris, Clinical Director with Solid Organ Transplant at the University of Cincinnati. Our transplant team is excited to be with you here today during our virtual interprofessional rounding. In light of our COVID-19 restrictions, I wanted to go through some things that have changed for our patients and for our transplant team.
Hi, I'm Karen Weed. I'm the educator on HCCP. I just want to talk to you a little bit about changes that have happened since COVID pandemic has hit us here. So the first thing that we started here is we actually limited visitors. So patients cannot have visitors here in the hospital. And that is just to keep patients safe and the visitors safe from contracting or transmitting anything while they're here. Next step that we did is that we actually went to universal droplet precautions for all people in the hospital. So that means that we're wearing a mask at all times in the hospital, and you have a face shield, which I'm not wearing, anytime you are in the patient care area in the room interacting with the patient. So that is the second thing. And then just yesterday we started universal testing every patient that is admitted to the hospital for COVID, so that we can get tests back pretty quickly and roll those patients out and make sure that we all stay safe during this time. Thanks.
Thank you, Karen. Now we'll transition into our virtual interprofessional rounding. Every morning, the transplant team gathers on a WebEx to discuss the patients who are inpatient, currently who have been transplanted or who have been readmitted. The rounds are led by our advanced practice providers or our surgical resident and surgical fellow, as well as the attending. After these rounds, the team will then meet with the patient to discuss the plan of care. So today we'll start off. Dr. Dewan is currently in the OR with a transplant, as well as the resident. So here's our case. Mr. Thompson, a 71-year-old male who had a deceased donor kidney transplant on April the 15th. He is post-op day number 2, but currently with his tachycardia and a little bump in his creatinine, the team is deciding on what the plan of care should be for Mr. Thompson.
Hi, Mr. Thompson. My name's Nick, and I'm the transplant pharmacist with the team today. Mr. Thompson continues on thymoglobulin induction therapy. His white blood cell count is good at 5.5 today, so he's okay to receive that third dose today, 1.5 mg per kg. His other immunosuppression is tacrolimus 6 milligrams twice a day with a trough level of 5.0 this morning. Cellcept 1,000 milligrams, and he's receiving 80 milligrams of solumedrol with his dose of thymo today. We have Bactrim and Valcyte prophylaxis due to start on post-op day number 4. Let's keep in mind that Mr. Thompson's abdominal discomfort could be due to the Cellcept, and keep an eye on that moving forward. With his serum creatinine being up today, I confirmed that he did not have a positive cross-match. We do have a donor-specific antibody lab pending today to test if he's making antibodies against the donor, but in the meantime, I'd like to increase his tacrolimus dose to get that level within the goal of 10 to 12. Medication teaching went well with him yesterday, and I'm planning to involve his daughter for re-education and pillbox packing at discharge.
Good morning, Mr. Thompson. I'm Caroline. I'm going to be your nurse today. I just finished up virtual rounds with your team, and according to your team, your creatinine is just a little bit elevated today, and your urine output decreased a little bit. So, according to that, we are going to be starting some fluids, monitoring your urine output closely. And we're also going to be testing your DSA to make sure you're not developing any antibodies against the donor. Aside from that, we got the plans for today is going to be ambulating, getting up out of the chair, walking the halls, making sure your pain is well controlled because you are slated to discharge within 2 days, and we need to make sure that you're properly adequately trained to take care of yourself at home. Also expect for some discharge teaching to be within the next 2 days from the transplant team. They'll go over your care for at home, what's your medications, and anything that you need to watch out for whenever you go home. And then also, so I'm going to make my rounds, but in the meantime, here is your call light. If If you need anything at all, anything for pain, or you need to get assistance to get out of bed, please push a call light and we'll be right in. Thanks.
Hi, Mr. Thompson. How are you doing today? Congratulations on your transplant. We just got done doing our virtual rounds, and I heard that everything went well with your procedure. So I want to go ahead and talk to you about what the next steps are. Obviously, you need to have some education before you go home. And we need to talk about some of the changes we've had to make, you know, in this time of with the COVID and everything to keep you protected as well. I saw in your chart that you had an email, so I've gone ahead and emailed you educational information. There is a PowerPoint. There is also a link to a YouTube video, which is me presenting the education that is always there for you to watch when you want to. Now, who is going to be your primary caregiver? I saw that you are a widow, and I'm sorry for your loss, and that your daughter Christy is going to be taking care of you. Does Christy have an email? And if so, is it okay if I go ahead and reach out to Christy and get that information from her? Great. I will go ahead and call Christy. I will email her the information so she is able to review the educational materials as well. And what we will do is, after you and Christy have watched the video and reviewed the information, because I'm leaving you this red binder as well, I will come into the room and talk to you and see if there are any specific questions you have to clarify. We also need to work with you on your phone to get you my chart set up on it so that we are able to do video visits. We really are trying to, again, protect our patients, and we don't want you coming here to the office if it's not necessary. And we'll make arrangements for you to get blood work twice a week, and then we will be able to call you and let you know what changes need to occur. Okay? Again, congratulations. This is so exciting, and we're very happy for you.
Hi, Mr. Thompson. It's Kathy Daly, your social worker with the transplant team. It's good to see you again. I followed up with the plan for your support. After we spoke this morning, I understand that you were a bit concerned about whether or not your daughter and sister were going to be able to work together to provide your care after the transplant. Good news. I talked to your sister, and she has expressed an ability and a commitment to assist you with your care, and she's also going to call in some assistance for you from her church, that she has a lot of members who are ready to assist as needed. Of course, they're going to wear their masks and only come in as needed, so you'll have the support that you need after transplant. If you have any questions before your discharge or after, please know that you can reach me anytime. I left my business card at your bedside table, and your daughter and sister both are very aware of how to reach me.
Okay. Good morning, Mr. Thompson. My name's Matt. I'm one of the dietitians for transplant. So I wanted to come by today and give you a little bit of information to take home with you regarding your diet after transplant and some of the guidelines that you would want to follow. So I've been looking through your chart, and it looks like your appetite has been good, but you've been having a little bit of complaint of abdominal discomfort. I noticed that when the nurses check your bowel sounds, they seem to be a little bit hypoactive. So what I would guess in that situation is that you're probably having a little bit of gas, maybe a little constipation, and once you get up and start moving around more frequently, I think that discomfort will subside. So looks like you're eating pretty good. They have it recorded that you're eating about 80% of your meals. Just kind of looking through some of your labs and other things, it looks like you may be a little bit dehydrated. So I'd encourage you to at least drink 2 to 3 liters of fluid every day. I know you're diabetic, so and I know diabetes was the cause of your renal disease, so it's really important post-transplant that you make sure that you continue to do good, watching the things that you're eating, not eating too many carbs or starchy foods, sugary foods, things of that nature, and make sure to dose your insulin or oral medications as they're prescribed. So some of the information I brought for you today has to do with food safety. Food safety is a big thing after transplant because you are immunocompromised and you are more susceptible to foodborne illness. So in this packet it talks about proper food temperatures and proper food handling, has a list of foods that are safe and things that you would want to try to avoid. In this packet I've also included a couple pages regarding some of the lab values that you will probably experience after transplant. One of these sheets is a list of foods high in phosphorus, because typically after transplant the kidney starts filtering out the blood much better, and phosphorus levels will drop. So I have that sheet in here for you. And then also I have a sheet for foods high in magnesium. One of the medications that you'll be on, called Prograf or Tacro, is known to cause low magnesium levels. So I like to give everybody this list of foods high in magnesium to help address that from a nutrition standpoint.
And that's the end of our virtual interprofessional rounds. Here's Mr. Thompson's case again. This is a picture of more of our interprofessional members of our transplant team. We thank you for this opportunity and we look forward to our debrief.